A mental health advocate who is visiting the far north at the moment says the region must rethink the way it talks about, treats and funds suicide prevention in order to try and save the lives of more First Australians. Gerry Georgatos spoke at the National Indigenous Empowerment Forum in Cairns today, but he's also in the region to provide support to families of two vulnerable children from remote communities. The National Suicide Prevention and Trauma Recovery Project Coordinator says greater investment in support services is needed rather than research. He believes if we get this right, we could see a significant drop in the suicide rates in Australia. I had a pretty compelling conversation with him earlier today, but I will give you a warning. It does cover some pretty confronting territory, and if you really prefer not to listen to that, well, I don't blame you from doing a bit of channel surfing. It's about an 8-minute conversation and a powerful one, so if you don't want to listen to it, you now have the opportunity to switch off.
1 in 3 deaths of Australians aged 15 to 35 is by suicide. But the stark and harrowing, staggering narrative is that half of all child deaths or youth deaths to age 17 are by suicide. Suicidality is on the increase, not decrease. And that's an abomination, moral, political, and that we haven't done enough. The nation should weep, but we should be at a point where we're galvanising the type of outreach and support, validation of trauma and disabling of that trauma, and that's just not being done. There's a lot of commitments, a lot of speeches, but the speeches and words do not define us. It's deeds and results that define us.
You're in North Queensland. You actually delivered a talk at the National Indigenous Empowerment Forum. What was the key message that you were trying to convey there?
We've got to do more than we've ever done before, but the key message is we've got to argue to governments and non-government funders and whatever capacities we have in our own organisations and services to allocate funding for outreach. The critically vulnerable are impoverished. The critically vulnerable have mobility issues, demographical issues, but by the same token, the majority of the critically vulnerable with suicidality are in the large towns and in our capital cities. And outreach does not just necessarily mean the remote communities. The remote definitely need that outreach. I travel to the remote. I travel to remote communities, but they've got the highest rates, not the highest suicide toll in terms of crew total.
What are the rates in remote communities?
Far North Queensland has the second highest suicide rate for First Nations in the country, thereafter the Kimberley. So Far North Queensland has a high suicide toll. Western Queensland has a high suicide toll. Regional, whether it's for First Nations people or all Queenslanders, Western Queensland, Southeastern Queensland and Far North Queensland have a high suicide toll for all Queenslanders. It's a similar story right across the country. But for First Nations people, the more north we travel and the more west we travel, the worse the suicide rates.
You've been in Cairns. You were asked to come and assist a couple of families that have individuals that are struggling at the moment. How does that play out?
Today I delivered a speak at a conference and I was distressed, even I, who's seen death daily for the last 10 years and who's worked with this suicidality, disordered thinking and a lot of unhappiness and trauma for the last decade of his life, and I've worked with thousands. I've worked with suicidality as young as 6, suicide attempts, 6 years of age, 2 children I can never forget. I've been able to get them to positive selves in a good place because we were there for them and we did the long haul support. Youngest suicide I've responded to is of a 9-year-old. That was here in Queensland, and that broke my heart. And I've kept in touch with the family ever since. And I spent 5 days in that community with that family after the loss of their child, 9 years of age. And there have been 3 children in this country, 9 years of age, who have suicided. The youngest losses this year are 12 years of age. So it breaks my heart. But your question, brother, I predominantly came out here to respond to a child who attempted suicide, which I drove to last night and will again tonight and the night before, to be by his side and to take him to a positive self and to work with him and validate him. And he was 7. He attempted suicide at 7 years of age. We can say all well and good that there are services there, but the services don't have outreach capability don't work 24/7. To get a GP to visit someone isn't an easy thing. You've got to schedule a visit to get a response, and people don't want to be waiting in emergency wards for hours on end. But I've set up structures and supports for this child, and I've had to do things in the ways that I have. But for a 7-year-old, it should be unimaginable. For a 6-year-old, it should be unimaginable.
Do they even grasp what they're doing, though? People would argue that they don't actually know what they're doing at that age.
I disagree with that premise. If someone attempts suicide, they know what they're doing. They know what they're doing. I know cognitively we widen and develop as we age, and for females, early 20s, completion of that cognitive widening, and for males, mid-20s, we take a little bit longer, brother, as males. There's cognition and there's cognitive understanding, and the presumption that they don't know what they're doing is simply a myth. It's not true.
We're hearing here from Gerry Georgatos. He is the coordinator of the National Suicide Prevention and Trauma Recovery Project. He's in North Queensland at the moment. You mentioned that you were contacted to come and help, and you were shocked to learn it was a 7-year-old that the family had concerns around. Why would people contact you? You live a long way away from North Queensland when there are services in North Queensland.
That's a good question, and it's a question I understand. The services are overstretched and underfunded, and that they should be describing the unmet need and the need for more to be done and the grim realities. I know often people talk about strength-based discourses, but the only way to a strength-based approach is if we actually describe deficits, and otherwise we strand people. We strand people into the unknown, unheralded, and there's a lot that I could talk to you about today about what most household Australians don't understand about brothers and sisters right throughout this country. But in terms of myself, to answer your question, it's reputational. I do the outreach. Our people do the outreach, and we have been responding now for years in terms of outreach, and that capacity for outreach isn't there, and people know that if we say that we will turn up, then we will turn up. But this family asked. There was a capability for me to attend, and I did mentor and support and counsel over the phone, but I had a capability to come. I did, and I made that commitment, and I'm here.
You say you've worked in or visited about half of Australia's remote Indigenous communities.
Over decades, yes.
Over decades, and you've worked with, you say, thousands of people. Are there any common threads that you think you can pull apart?
Socioeconomic disadvantage, socioeconomic stresses. For First Nations people, if I can give you an example, there have been more than 100 First Nation suicides this year, 10 alone in Townsville. You should know that, and it should be widely reported. Some will argue that if we report that, and that it will give rise to more. I disagree with that. I completely disagree with that. We don't do that in any other space, and we were doing it with suicidality, in the space that we actually need to be talking about this more. If we don't talk about domestic violence, we're not going to reduce domestic violence. If we don't talk about sexual predation, we're not going to reduce sexual predation.
You said the time for research is over when it comes to suicide, and the time for action is now. What do you mean by that?
We've had hundreds of reports and thousands of recommendations, and all these reports are much the same. We're rebadging each other's work, updating stuff and arguing that everything has to be real time. That's just crap. We need to invest all monies available in suicide prevention, authentic suicide prevention that can reach people, or people can be reached by in one way or another. Poverty is the narrative that leads to suicidality for the majority of Australians. What can take your life will be many times more likely to take your life below the poverty line than above the poverty line. The majority of domestic violence deaths, homicides, that sad tragedy, the majority of those deaths are below the poverty line. They're in the poorest postcodes of our country. They're not in the wealthiest suburbs. For First Nations people, nearly 100% of the suicides, and my data is robust and published all over the country, nearly 100% of the suicides are below the poverty line. So they've got a lower rate of suicide, First Nations, Aboriginal and Torres Strait Islander people living above the poverty line than brothers and sisters who are non-Indigenous living above the poverty line. So go figure. The way is to actually improve life circumstance and to create that agency that one needs to have.
Why do you think we haven't gotten on top of the suicide rate in Australia yet? Why do you think this is an ongoing issue?
I've spent a decade trying to actually, alongside others, actually bring an awareness of the suicidality. We've got a higher rate of suicide in the United Kingdom, but Australia hasn't paid its respect to suicidality and hasn't invested in it and hasn't got an authentic suicide prevention framework at this time. But our governments have not invested in suicide prevention, and they're still shaping the narratives, and they don't understand it, and they need the right people with the right level of expertise, and they need people who actually have that connection at the academic level, but predominantly on the ground at the coalface, who can demonstrate ways forward, who have a compelling narrative of working with thousands and not losing anyone. And that will not always be the way, brother. Someone will be lost, but it just can't be anyone. Australia's lagging behind. Australia's a world leader in suicide awareness. Australia is failing in suicide prevention. They're not in sync with each other.
Gerry Georgatos in North Queensland at the moment and the coordinator of the National Suicide Prevention and Trauma Recovery Project.